Last chapter for the week, chapter 4. This is more of a practical application of what you might be doing in your career field. It involves how you might see a medication. So in other words, the route of delivery or the medication form. So the chapter starts off talking about how the drug form is the preparation in which the drug is supplied, and the route of delivery is the means of absorption, which we talked a lot about in the last chapter. Standard drug forms. We covered a little bit about enteral versus parenteral. Enteral is anything that's going to get swallowed or put through the GI tract. Enteral can include PO or it can include rectal. And then everything else falls under parenteral, which is absorbed directly into the bloodstream through either injection or possibly sublingual absorption, etc. So let's talk about oral dosage forms first. The good old tablet. Everyone's seen one. Everyone knows what one is. It's literally just a hard oval or circular looking pill, and it dissolves in the stomach. The enteric coated tablet is meant to dissolve a little further down in the gastrointestinal tract. It's coated so that it takes a little more time to dissolve. A capsule. Capsules are fun because they can have powder inside. It's usually two little pieces of plastic that get put together. They're sort of circular and oblong. And inside, you can either have a powder that has the medication in it, or you can have little tiny beads that contain the medication. Sometimes there's different colors in those beads, meaning that they dissolve at a different rate. So as you can see, just like enteric coated tablets can dissolve a little slower, capsules can as well, or at some releases now, some releases a little later. So you can definitely make sustained release formulations with that. You can do the same thing with a tablet, it just doesn't have all those different pretty colors in it. A lozenge. One I'm most familiar with is probably throat lozenges, like when you're sick for a cough. Those dissolve over time. You're not supposed to chew on them. However, they contain drug, and that dissolves into either directly into the bloodstream while it's in your mouth or down into the esophagus and the GI tract. Some liquids that you might be familiar with, but we kind of need to discuss the differences. Suspensions, emulsions, elixirs, and syrups, as well as solutions. The most important one out of that is going to be an elixir. There's not a ton of elixirs out there. However, the reason they're important is because they contain alcohol. So if you have a child, you want to be careful how much of an elixir you're giving. Does it contain a lot of alcohol? Same thing goes if you're giving alcohol to an elixir that has alcohol in it to someone who's either a recovering alcoholic or trying to avoid alcohol at all costs because of an interaction. Suspensions are a liquid form of a medication that must be shaken well because the drug particles are suspended and usually settle to the bottom over time. Solutions are more of an aqueous, evenly dissolved liquid, so you don't have to shake it well. Let's talk about suspensions for a minute real quick too. Sometimes oral liquids come in dry powders which must be reconstituted. This is pretty common for antibiotics. So they have to have water added to them and then be shaken. And again, anytime that bottle has sat for a while, they need to be shaken again. An emulsion is a liquid preparation that contains oil and fats and water. Usually those might need to be shaken or sort of turned side to side to kind of mix them back into their evenly distributed form. Rectal routes of administration. Suppositories and enemas. Suppositories are, think about, how can I describe it? Like, I don't know if any of you have ever cooked with coconut oil, but at room temperature, it's usually solid. And the minute you touch it or heat it just a little bit, it melts. The same thing happens with a suppository. It's a wax-like substance that's solid at room temperature, and then once it's warmed to body temperature, it dissolves almost immediately. And that is absorbed from the rectal tract because there's a lot of blood vessels down there. Enemas are a liquid form of medication for rectal administration. And there's a few different types. Some of them are used for constipation, some of them are used for GI irritation. It's just another option when we're doing rectal administration. Injectable. There are a ton of different ways to inject a medication, the most obvious one being through an IV. This, again, has 100% bioavailability. The drug starts acting immediately. The drug can be sort of similar to reconstitutable solution or suspensions, in that drugs can come in a powder form as well in a vial, and they'll need to have something added to them to make them liquid in order to be injected. Many drugs that are in those vials need to be further diluted with normal saline or dextrose before they can be administered. Drugs can also be in an oil or water base, and I believe that can slow absorption if they are, not as quick as just having it sit there in the blood vessel in a normal aqueous base. So drugs can be given IV by push, which means really fast, or by infusion, which means over a longer time. So an IV push medication might be one for nauseousness. We want to get rid of that nauseousness quick. That medication is formulated to be pushed right into the IV line. Whereas an infusion might be more like maybe we're rehydrating someone and giving them fluids. That infusion is going to run probably 24 hours a day. A piggyback is usually a medication that's given a few times throughout the day, or maybe just once a day, but it doesn't run all day. It's piggybacked onto the line, so you can piggyback an antibiotic infusion to be given twice a day onto a line. You piggyback it in the morning and the evening, and that would run at the same time that infusion, those fluids are running. So other options for injectables, others you might be familiar with, IM and subcutaneous. IM goes directly into the muscle. It's a pretty quick absorption because the muscles have a lot of blood vessels, and it's reliable. And subcutaneous, which goes just directly under the skin, a little bit slower of an absorption, so if you're looking for something to go in over time, that's what the route of administration that would be used. Intradermal, you're not going to see too often. The only one we have intradermal is the TB test, which I'm sure some of you have had. And that's where they just stick that nasty little bit of fluid right under the top layer of skin. It's not as deep as subcutaneous, and if you have a reaction, then you're a carrier for TB, and most of us don't have a reaction, and it goes away. Epidural, this is pretty common in hospitals, especially after major thoracic surgeries. Epidural is an injection, a line that runs right into the epidural space in the spine, and it usually is used to either numb a patient from the waist down or also to deliver pain medication. Less common, intraosseous, which is an injection right into the bone. Intraventricular, which is into the ventricles of the brain. Intraspinal, which can be used to deliver pain medication. And intracapsular or intra-articular, which is used to, actually more common than most people would know about, used to inject into a joint. A lot of people with arthritis will get steroids injected in their joint to give them some time before that pain comes back, usually a few months. Topical drug forms, creams, ointments, lotions, liniments. You'll become familiar with those the more you see them. What can I tell you about those? Ointments and liniments are usually thicker and more oily and a pain in the butt to clean up. However, they are very effective for dry, cracked, broken skin, as opposed to creams, which rub right in and don't necessarily leave a huge mess. Eye, ear, and nose drops, those are self-explanatory. Eye ointments, usually used at bedtime because they do blur patients' vision. Vaginal creams, as well as vaginal suppositories. Those are some other topical alternatives if somebody is having either vaginal dryness or a vaginal infection. Buccal tablets, which sit right in the cheek of the mouth and dissolve. There's also sublingual tablets, which go under the tongue and dissolve. It's not considered enteral because it is dissolved directly into the bloodstream in the mouth as opposed to being swallowed down the GI tract. Inhalation. The book kind of missed a new one on this one. There's spray or mist, nebulizers or inhalers. There are dry powder inhalers, which the book missed out on mentioning that one. Dry powder inhalers are administered a little differently than spray, your typical what they call HFA inhalers, where you just push down and breathe in, but they are becoming more common. Supplies for administration. This chapter was quick. Some of these are pretty blatantly obvious. We've all given either our kids or someone in our lives medicine, whether it's through a syringe, an oral syringe. Perhaps we've had to give it to them in a little medicine cup that has the amount, like mLs or teaspoonfuls, measured on the side. In the hospital, you might become familiar with using a metal crusher or a pill splitter. You might also use a mortar and pestle to grind things up. We talked a little bit earlier about how vials of injectable medications come. Most of them are glass vials with a metal top and a rubber center so that you can pierce it with a needle. Some of them are glass ampules that you have to break and then draw the medication out and filter it because it could have glass in it. So those are a couple different options for how you might see those medications stored and stocked. Needles. Needles are a fun one. It's really something you need to get your hands on to understand before you can fully become competent in it. The syringe screws onto the needle. It's like a Lure lock, and it's tight. Once you have it all the way tightened, they're not going to come apart. Needles can be different lengths. Needles can also be different thicknesses. So a really thin needle might be used to give that intradermal shot we talked about earlier, whereas a thicker needle might be used to start an IV line. The higher the number, the thinner the needle. So an 18 gauge needle is a lot thicker than a 22 gauge needle. Keep that in mind. Also keep in mind out there are oral syringes in addition to injectable syringes. You always want to make sure you know what you're looking at. Is this an oral syringe or is it an injectable? If it's an oral, most likely it's not going to have that screw-on device at the end. It'll just have a plastic tip, and if you tried to screw something onto it, you could pull it right off. This is important to keep in mind because it opens you up for mistakes when you're not aware of what you have in your hand. If you administer an oral medication through an IV, you have the potential to harm a patient. Not always true for the other way around. However, we always want to have our best habits and make sure that we're doing the best work we can. So that covers week 1. Due by the end of this week is the study guides for chapters 1, 2, 3, and 4, and there will be a quiz as well for these chapters. You can find the information on when those are due in your syllabus, and if you have any questions, email me. I'll be around checking my email as frequently as I can. Have a great day, guys.